Hello, I'm Dr. Martha J. Thank you for your interest in LASIK vision correction. I hope this video will teach you a few things about LASIK and allow you to make a decision about whether it might be right for you. But really, if you are interested in LASIK, the main thing you should do is call for a free consultation, because you never know if you're a candidate or not, and what we do at that consultation is we evaluate your vision and your eyes and inform you about what LASIK can do and what it can't do, and so then you have a better idea of whether it's a good choice for you. LASIK is a procedure that changes the shape of the surface of the eye, and the purpose of the procedure is to make it so your distance vision is as good as possible. We can do LASIK to improve your near vision, but with that you lose some of your distance vision. That's called monovision. So we would set your dominant eye for far away and your non-dominant eye for near. Generally those under 44, 45 aren't interested in that. They mainly want to improve their distance vision. LASIK improved quite a bit about 5 or 6 years ago, and that's when we changed to the all-laser LASIK. And what we do now is we use a laser to make this little flap on the surface of the eye at the beginning of the procedure. In the past it was done with a metal blade, and that was fine when it was the only technology out there, but the problems with the metal blade involve the fact that it's a blind pass over the surface of the eye. So as a doctor, you can't see under that little flap until it's been generated. So you lift up that blade and sometimes the flap would be off center, not perfectly round. Anything like that can cause scarring and blurry vision that's not fixable. Now we do it with the laser. So what happens with the all laser LASIK is at the beginning of the procedure, I look right through the center of the machine. I know it's centered over the pupil every time, and I send little bubbles down to whatever depth I want it to go to, usually 100 or 120 microns. So these little bubbles go down, it's totally painless. They zoom across the cornea in 21 seconds. Each and every time the flap is perfect. It's almost impossible to have a problem with the flap when you have all laser LASIK. The laser we use to change the shape of the eye is the VisX star laser. So once we make that little flap, we rotate you over to the second laser, lift the flap, and change the shape of the eye. The advantages of the VisX laser are many. It is the premium laser out there for refractive surgery and has been for some time. It's continuously updated with its software and hardware. The safety features that I like, number one, include the eye tracker. So what happens with the eye tracker on the VisX machine is it locks onto these little crypts or irregularities in your iris. So that means if you turn a little bit under the laser, it's going to make sure your treatment is oriented exactly the way it needs to be. Second thing that's very important about the VisX machine has to do with higher order aberrations. And this is a physics term. Most of us are somewhat uncomfortable with physics, but it has to do with the way light enters the eye. And it's different for each and every patient out there. What the VisX machine does is it actually measures the higher order aberrations for every patient. So we have a thing called a wave scan that we generate, and if it looks like that's a significant part of the vision problem, then we use that wave scan to guide your treatment. The VisX machine is the only one that customizes that for each and every patient. Some of the less expensive machines out there say that they treat higher order aberrations, but they take the same wave scan as sort of an average of all populations and lay it on the top of the treatment of every single patient. So it's not individualized, and that's why you see better with the VisX than you do with the other machines. The first laser is called the Interlace, the one we use to change the shape of the eye, and the second one, as I said, is the VisX machine. These were independent companies for a number of years, and a few years back Abbott bought both of them. And now they call it eye LASIK. So when you see the little eye and the LASIK, that means that the treatment they're talking about involves those exact two pieces of equipment, the Interlace and the VisX Star S4 laser. Those are both the premium lasers out there for refractive surgery. They have the best track record, and I have been very comfortable using them for a number of years, including all of the updates with the software and the hardware. So if you are interested in LASIK, you really need to come in for a screening, because you don't want to get too excited about a procedure that you're not a candidate for. So what we do at a screening is we look at your prescription. We want to make sure that it hasn't changed, that it has to be stable for distance. We check the curvature of the surface of the eye. We don't want it to be too flat or too steep. And we check the thickness of the cornea. If your cornea is too thick, there's potentially something wrong with it. So afterwards, your whole cornea can become cloudy and you'd have blurred vision. If it's too thin, once you lift that little flap and change the shape of the eye, the whole surface of the eye could warp, and again you'd have blurred vision. So just because you have a prescription that you think is in the category that would successfully be treated with LASIK doesn't mean that your eyes would be candidates for it. So that's the main thing that we do at the screening, is we check all of those things and tell you whether you can have LASIK or not, and then have you see a video, learn a little bit more about the procedure. So call our office at 262-241-1919 or look at our website at www.lakeshorevision.com to learn more about LASIK vision correction. Thank you.